Alright, so for this video I want to show you the blood vessels for the fetal pig. So I already did a lot of cleaning up here. You can see the neck, the thyroid is still intact, but I removed most of the thymus. This is the tool you want to use, your dull probe. So at least in this picture, before I cut away the veins, let's go through the jugular. So external jugular and internal jugular are seen on both sides, so external and then internal. There's a cephalic vein, and then there's a subclavian that goes down into the arm on both sides. So what I'm going to do, I'm going to now cut the vena cava, superior vena cava. As I cut that, I'll get a better view. Alright, so what I've done, I've removed all the veins up in the thoracic region so you can see a good view of the remaining arteries. So here's the pulmonary trunk, that's still intact, but this is the aorta posterior. So the aorta has two branches, one of which is the left subclavian. So you can see this left side goes up to the arm, and that's going to be the axillary and then the brachial. And then this is the other branch, this is the main branch, this is the brachiocephalic trunk. So in humans, the brachiocephalic trunk just has the right common carotid and right subclavian. This one in the pig also has a left common carotid. So you can see these now that I've removed the veins. Now the aorta continues down. It runs along the vertebrae, goes all the way down. You can even see some intercostal arteries. So down in the pelvic or abdominal cavity, you can see the aorta, and then coming off the aorta, a renal artery going to the kidney. Coming out of the kidney, you can see the blue renal vein, and that goes right here into the inferior vena cava. You can also see the inferior vena cava when you look at the heart, when you lift up the heart here. So remember, I cut the superior vena cava away, so you don't see anything up in the neck area. Instead, you can see as it descends. Okay, so then, so the kidneys, both of them have the renal artery and renal vein. Do not confuse this. This is not a blood vessel. These are called ureters. They carry urine from the kidneys to the bladder. So this is the actual bladder, right? It's called the allantoic bladder. The umbilical artery, the abdominal aorta continues down, and it's going to lead to the two umbilical arteries. There's an umbilical artery on each side of this bladder. The umbilical vein is right here. You had to cut it. Came from the liver. So when you had this flap, you cut the umbilical vein to open up this flap. So when it's open, you can easily see things. So the abdominal aorta continues down. You can see the external iliac, which is going to become the femoral, and this is the deep femoral artery. Additionally, you can see these really small arteries here. This is a gonadal artery, and since this is a male, that's called the testicular artery. It's going to go into the testes, which are found here in the scrotum. Okay, so that should be the major blood vessels.